Welcome. This is Breathe California TV. Breathe California is the lung health organization for the state of California. We have 6 chapters throughout the state, and today we're talking with the executive director of Breathe California of the Bay Area, Margo Sidener. We're going to be talking about an issue that's been a big deal these recent years, which is getting equitable lung health for all different types of people in the population. So come back and join us after this public service announcement.
The different therapeutic methods that we can help our very low socioeconomic status clients who have no alternatives, no anything, and there's still about 15 different resources we got out of this that if you have no resources, no service connection, you can still get aid.
That they are connected, one encourages the other, and that the process of change from backing off from the tobacco is the same as backing off from any other addictive drug.
Everyone can benefit from this training that we just were offered today. I would not take it back.
Welcome back. I'm Terry Trumbull. I'm a volunteer for Breathe California. If you can come help Breathe California, our phone number is area code 408-998-5865, and we'd love to have you help us. So Margo, you got something for people to do if they call?
We always have something for people to do if they call.
So tell us a little bit about your background. It's been my honor to be working with you since, I want to say since 1988.
You would be correct. Well, my background is that I'm a health educator, and I have my master's in health ed, and I also am a certified health education specialist. So basically, health educators try to keep people healthy and prevent them from getting sick. So I came as a volunteer to Breathe California, and I ended up coming on staff a year later, and then I worked my way up through several health education positions to the CEO. So I've been there for 41 years, counting my year of volunteering. And I still love it. It's a very rewarding career.
Well, I ran across some sage's statement that you seem to fit perfectly, and it says, find something that you enjoy doing and do it for the rest of your life and call it work.
Exactly. It's not really been work. As you know, I tried to retire and came back. So our agency is 111 years old, and I haven't been here that long, but I've been here an awful long time.
Yeah, and you've done a great job, which is why you've been able to stick around so long.
Well, thank you, Terry. When you love what you do, you generally do a better job, don't you?
Yes, absolutely. So tell us about Breathe California and what it does.
Well, Breathe California started out as the local tuberculosis society in 1911. And we now actually have merged some units. So our new name is Breathe California, the Bay Area, Golden Gate, and Central Coast. And along the way—
That's too long.
I know. That's why everyone just calls us Breathe California. Actually, a lot of people shorten it to Breathe, but we'd prefer you at least say Breathe California. But our agency really devoted its work to tuberculosis for about 50 years because at that time, TB was responsible for 1 of every 8 deaths in the whole country. It was very, very serious. And once they discovered antibiotics, things changed. We still have a lot of TB here, don't get me wrong, but it did improve a lot. So we expanded our mission. We now fight all lung disease, and we work with our communities to promote lung health. And that really takes in a ton of things. You can imagine, because your lungs are open to the environment. So we're not just worried about different diseases. We're worried about things like air pollution and emerging things that are coming up, like COVID. COVID is a respiratory disease. So we've been very busy the last 2 years working on COVID-19, working trying to help people and give them tips about handling wildfire smoke. And of course, there's still the teen vaping epidemic, and we've been doing a lot on that front.
So last week's program, Jason Cross did a good job of talking about that.
Yes. But we continue, even though we have all these things coming up that are new, we continue to still do our traditional work in the community, which includes things like helping people with COPD, helping children with asthma, helping the seniors who are very vulnerable to all types of lung disease, giving people information, and really serving the general public.
So I've gone out to volunteer at a number of health fairs, which has been a significant part of your education role for a long time.
Yes, and before the pandemic, we were still reaching about 40,000 people a year. And about half of that was through just being in the community and doing health fairs and festivals and those kinds of things to reach people.
So you mentioned it a couple of times, but I frequently have opened this show by saying that my personal emphasis has been on trying to do prevention, that the American healthcare system is, as far as I'm concerned, way too oriented towards treating things after you've gotten a disease or gotten sick. And so it's great having you on to talk about prevention.
Yes, that's what we're all about. And we do, in addition to educational programs, prevention work always has to include policy work. So we do a lot of advocating for lung healthy policies of all kinds and air quality improvements. And we also fund research. It's very important to keep that going. And I guess everyone knows how important research is after COVID-19. But those are our three prongs that we use in our prevention work.
About a year and a half ago, I quit college teaching, but as you're well aware, because you would meet and talk with my students when they came to visit Breathe California's offices, they were uniformly surprised to have brochures to help people cope with 13 different types of lung disorders and in multiple languages. So you have quite a variety of both diseases and communication issues to get across the very diverse population that we have in your service area.
Yes, if I think anyone who came into our office and went in the back, we call it the literature room, would just be astounded by how much literature we have, how many different topics there are, and how many different languages there are. I've never really counted them all up, but we have information on most parts of our work that in 4 or 5 languages, and some of them we have in more like 15. For instance, TB, we have in most of the languages that are here in the Bay Area. Not all, I think there's about 50. We don't have those, but we have lots. So
we had said up front, we're going to be talking about underserved populations. What's that mean in here in the South Bay?
Well, First of all, lung disease has always been an issue that is more, or a disease that's more prevalent in our disadvantaged communities from the time that we were fighting TB. And that was because it spread more readily when you were in very crowded conditions, which people were in the poorer sections. And almost all lung disease is made worse by pollution. So those are two important things that we have to keep in mind as far as talking about health equity. And we know that, for instance, asthma in disadvantaged communities is way more prevalent. And so we look at the causes of that. And again, we're focused on prevention. So we need to improve really a lot of social equity in order to bring people up to a healthier state to combat lung disease. And it's not that people of certain races get lung disease more easily. It's that they don't have the resources to combat it, and they really don't, and often they don't have the general health to fight things off. I think it's been so easy to see the social divide that we have in this country in terms of health when you look at COVID. Obviously, those people who contracted it, if they were in the upper scale of socioeconomic groups, would have a much better way of fighting it off than others. And some of that is access to health care, having health insurance, having good food nearby instead of a food desert, and being able to afford that. So there are a lot of issues. And when you bring in air pollution, that's a really big deal.
So I've done shows with a couple of Santa Clara University environmental studies professors who, just to reinforce your point, very high correlation between health problems and where our freeways are. If you're close to roads, and we have over 1,000 schools in Santa Clara County that are relatively close, they're breathing very poorly.
Yes, and we didn't have all that research until fairly recently in my 40 years of working with it. When I first came to the agency, there wasn't research to tell us how air pollution impacted individuals, whether or not they had lung disease. And now we know that that air pollution actually causes lung disease. The first thing we learned with research was that it worsened lung disease. It did things like cause more asthma attacks. But now we know it actually causes asthma. And that's there were some very long studies that went over about 10 years, and we're down in the LA area when LA was actually a little more polluted than it is now. And that told us a lot about air pollution that we didn't know before. So now that we do know these things, we need to work so that we can do something about them. And that might be providing air filters to people who live close to the highways, and then gradually rezoning things so that we don't have people that live within a mile of the highways. That'll take a very long time in California because of the whole housing issue, that we don't have enough housing. So it's not something that will happen soon, but we need to keep this on the top of our mind that we're working toward it. And of course, Terry, that we're really big into transitioning away from petroleum and into EVs and other better fuels. And if we can do that, then living close to the highway won't be as big an issue as it is now. But with all the diesel trucks that is a huge issue right now.
So Margo and I are going to talk about the smoking and air pollution and what's relatively the biggest cause of lung problems after a 30-second public service announcement. So we'll be back in 30 seconds.
What it feels like to have an asthma attack is, well, you can't breathe and you can't tell anybody that you're having an asthma attack because you can hardly talk. You can maybe say 1 or 2 words, but you can't say much else. Breathe California has helped me come in contact with more asthmatics and more people who have the same case as I do. It's important to me because I don't feel like I'm alone in the fight against asthma.
Welcome back. This is Breathe California TV. Margo Sidener, Chief Executive Officer of Breathe California of the Bay Area, Golden Gate, and Monterey Bay, is with us. Jason Cross, who works for you, did the show the last 2 weeks and suggested that the worst thing an individual can do is smoke. But if you're not a smoker, your biggest health problem is probably going to be with air pollution. Talk a little bit about the success that you've had in your 40 years on smoking reduction. What's the number of people smoking now?
Wow, it's a wonderful thing to look back on, Terry. Only about 7% in Santa Clara County smoke every day now. And in the state, it's more, in the region, it's more like 10%. But we've brought it down from about 24% when I first started. And we had a ton of teen smoking. That's why it's very crushing to me to see this vaping epidemic, because we had teen smoking down to about 1% were using tobacco. 1%. When I started, it was in the 20s. It was like 21%, and adults were 24%. And now it's back up to 13% because of this flavored tobacco and vaping. So it's, it was wonderful. I was really on a high for a lot of years there, but then the last few years have been pretty disappointing. It's like the tobacco industry's found this very clever way to lure all of our youth into smoking and just sort of do away with half of my life's work. So we hope that we can get a handle on that. And as you know, we fight tobacco on every front. And part of that is through policy. And I'm so happy to say that we have gotten 16 policies passed for tobacco control in the last 2 years. And that is a huge number of policies. So in much of the Bay Area now, you cannot buy flavored tobacco or electronic cigarettes. And we're working to make that happen more and more. And even the city of San Jose, which is the 10th largest city in the country, banned flavored tobacco, the sale of flavored tobacco and flavored electronic cigarettes. And that's going to take effect this year. It happened at the end of last year, and it's going to take effect. And we're very hopeful that this will make a huge dent. The city of San Jose is the largest city that has banned menthol, by the way. And as we were talking about social equity, menthol is targeted at specific groups, particularly the African American population. And most African Americans who smoke menthol. So we're very much hoping that this really starts to make a dent in the smoking rates in many of our populations who have been left behind. They're still smoking at higher rates. So it's been a very exciting career. Also on the secondhand smoke front, our agency got the first secondhand smoke ordinance in the country. And many after that were in the first year. And now, as you know, you can hardly smoke in any building anywhere in California, which is great. But we also are addressing smoking outside, because secondhand smoke is really significant even outside. So that when you go to
secondhand smoke, just be clear about this, Margo. If I'm smoking a cigarette and you're within a few feet of me, you're in essence going to be smoking along with me.
Yes. And that's
So,
exactly right, Terry. And in fact, smoke can actually travel like 20 feet. So if the conditions are right and you're sitting outside and there's a certain breeze going a certain way, you can actually pick up that smoke a lot further away. So those of you at home who think that you're kind of crazy when you think you smell a cigarette that's way over somewhere far from you outside are not crazy. It actually can travel a long way. And of course, now we have third-hand smoke. We have to worry about after people have been smoking and residue that might be, for instance, on a carpet for a baby to crawl around on later. So it's, you know, as we've done all this great work, Terry, there's still more work to do.
absolutely. So in protecting against secondhand smoke, my recollection is you've had a great deal of success with preventing it in parks. And most people might not realize that smoke in apartment buildings is very easy to move from one apartment to another. So those are things you've worked hard to control.
Yes, and we have been successful getting some cities to pass ordinances that regulate smoking in multi-unit housing. That's part of that number of bills, the 16 that I quoted. And we're working right now on others, getting other cities to come along and recognize that there have to be policies that protect people. We have run for 30 years a secondhand smoke helpline, and that helpline is utilized a lot by the populations we're talking about. The people who live in apartments where they're getting this secondhand smoke are often those who don't have enough money to move somewhere else. They can't just leave because their neighbor is smoking and it's hurting maybe one of their children who has asthma, or maybe a senior who has COPD, or a pregnant woman who doesn't want to be exposed to that. So our helpline has increased recently in the number of calls that we're getting. And that is, and part of it is because of marijuana smoking too. Now that it's legal, that's another secondhand smoke issue. And we're trying to work with our cities to have them understand that.
So just to be clear about that, 26 states have legalized use of marijuana, but it's still illegal federally. And as I mentioned to you, I had a student at Yosemite who got a ticket from a ranger there for smoking. So there is some mixed signals on it. But the key thing there is that the smoke, in spite of any claimed medicinal properties, is in fact a danger to your lungs.
Exactly. Just because something is legal doesn't make it okay for your lungs. And, you know, tobacco is the perfect example of that. It's always been legal. And now we find that people who are smoking marijuana tend to forget also that it could harm their neighbors. It's one thing to decide that you're going to smoke anything, basically, but it's quite another to have that smoke harm someone else. And whatever you're smoking is going to harm someone else if they breathe it in. So we want people to understand that it's not an issue about being legal or not, or for a medicinal purpose or not. It's what are you doing to your neighbors?
So we haven't done much talking about one breathing problem that's very significant, namely asthma. Why don't you talk a little bit about that?
Well, asthma, and I should say, in talking about social equity and health equity, asthma is one of our benchmarks because it's often exacerbated by air pollution and living in areas where there is more air pollution. But we also have a lot of other issues in having people get assistance and understand. It's very complex when you look at the medication regimen that you have to follow when you have asthma. And so we have long worked with the parents to try to give them the information in a way and in their language so that they understand. And we actually go and do home visits. And now we have a wonderful program. We have grant funding to be able not only to do the home visits, but to help them remediate any problems that we find. So we could give them vacuum cleaners and hypoallergenic bedding, and we can provide air filters. Actually, the Air District works with us to provide air filters to all of those that we visit who have asthma or serious COPD. And we can even do some improvements to their home. If they have a leak that the landlord has ignored forever, we can actually go in and repair that so that they don't get the mold buildup and so on. We've done things like buy secondhand refrigerators for people, pay for cleaning for people that had issues, they were disabled and couldn't clean. So we have a little bit of funding now that's really exciting because in the past, we could tell people, okay, here's what you need to do to cut down on your asthma in your home, but we couldn't help them get that. And so when you're talking about communities that have health inequities, then you have to look at how do you help them? What can you do for that?
So in that vein, you suggested, and we did maybe 4 to 6 months ago, a whole program on inhalers. If you've got lung problems, you know what an inhaler is, but do tell us a little bit about them. And my recollection is there are different types of inhalers too.
Yes, and some inhalers are maintenance inhalers. They're corticosteroid inhalers, and you need to keep taking those every day, no matter how you feel, just to keep the inflammation down. And others are rescue inhalers, and those are usually albuterol type drugs that are bronchodilators that instantly open up your airways. So you need those for rescue if you're having a serious asthma attack. But often we find that the caregivers and the parents get those totally confused. So that's a big thing that we do to help, is to educate them of which is which.
According to my watch, we're just about out of time. How do you want to wrap this up?
Well, I would like to invite anyone who has problems with their lungs to call us and have us help them find a solution. And if it's something that is environmental, we'll look into that. We can give them referrals. We can tell them where we're doing testing. We really want to help people, and anyone who speaks a different language other than English and wants to volunteer, we would love to have you give us a call, because that's one of the first steps in helping everyone, is to be able to speak with everyone. So please give us a call if you can volunteer.
All right, we'll see our audience next Monday and with some other new show that we hope will be as good as Margo's was.